All right, so hello, I'm Jessie. I'm gonna be doing your health assessment today. So I'm first gonna wash my hands, and then I'm gonna identify the patient. So I'm gonna look at the wristband. So can you tell me your name and date of birth? Yep, her name is Barbara Green, date of birth 2872, and that's what it says on my orders. So Barbara, do you have any allergies to medication, to food, to latex? No? Okay, good. So I'm gonna close the curtain for privacy. Wash my hands once again. I'm gonna make sure that the room is clean, there's nothing in the way, and that everything's prepared. So I have my physician orders. My orders say to complete a physical assessment on my patient. So Barbara, are you in any pain today on a scale from 0 to 10? 0 being no pain, 10 being the worst pain of your life? No, okay. So do you have any questions for me or any concerns that you want me to know before I get started? Okay. So I'm gonna first make sure that my bed is at working height. And while I'm doing the assessment, I'm gonna be assessing her mental health. So making sure that she looks good, her behaviors are normal, cognitive function, and that her thought processes are correct. So Barbara, can you tell me what day it is today? Yep, today's Thursday. Can you tell me what year it is? Yep, the year is 2020. Do you know who the president is? Okay, correct. And do you know who you or where you are? Yes, I'm in the hospital. Okay, so my patient is alert and oriented ×4. So I'm gonna make sure that the patient is positioned at a 45-degree angle, that she's sitting up. And so Barbara, I'm just gonna palpate your head, make sure that there is no lesions, no bumps. I'm gonna look at the size, I'm gonna look at the shape, make sure that it's equal. I'm gonna take a look at the hair. Is it a good color? Is it a good texture? Is it good distribution? Good. So my patient looks well kept and nice and groomed. So I'm gonna next do the ears. So I'm gonna look at the ears, see if there's any swelling, any excessive serum. Make sure that there is no red areas and no drainage. And then I'm gonna go ahead and do the joints, the temporomandibular joint. So Barbara, can you open your mouth for me? Good. And now I'm gonna put some resistance. So can you open it against resistance? Okay, good. So I'm gonna look at her ears, make sure that her ears are good, her eyes are good, her nose, so the sinuses look clear. And I'm gonna check her septum. Okay, so her septum is midlines and there looks to be no sores or anything going wrong in the nose. So her eyebrows look good, her eyelids look good, lashes, and it all looks clear. So then we are gonna check for pupil visual reflexes. So I'm gonna dim the lights in the room. And I'm gonna grab my pen lights and I'm gonna go from the outside in, checking for accommodation and looking at pupil size. So good. Pupils do accommodate, they're 3 millimeters. And I'm gonna go ahead and turn the lights back on. So I'm gonna take my pen light, and Barbara, I just want you to follow my pen. So I'm gonna go up, down, to the side, and then I'm gonna go far away and I'm gonna move closer. Okay, so it all looks good. The eyes are perilla, so they're equal, round, react to light, and they accommodate. So I'm gonna move down to the neck. So I'm gonna palpate her neck. I'm gonna check her nodes, so her preocular, posterior, her occipital, which are behind the ear, the submental, submandibular, jugulogastric node, her superficial cervical, her deep cervical, her posterior cervical, and her supraclavicular. So they're all good, no swelling in any of the lymph nodes. And next I'm gonna check her mouth and her throat. So if you could just open up and say ah so I could see inside. Okay, so there's no lacerations, everything's normal color, her teeth look good, her lips look good. And do you have any dentures? No? Okay, good. So next we are going to do the carotid pulse. So I'm going to make sure to just do one side. So let me go ahead and check your pulse. Okay, and we would typically do that for 1 full minute. So the force is good, it's 2+, and it's regular. So Barbara, I just want to know, how often do you perform a self-breast exam? Okay, good, once a month. And so you know that it should be once a month after your period, and then do you get a menstrual cycle still? Okay, is it normal? Okay, and if it was a male, then we would ask about the self-testicular exam. So now I'm gonna move on to the chest and to the back. So I'm gonna put my hands on your shoulders, Barbara, and I'm just gonna ask you to push up and shrug your shoulders against resistance. Okay, good. And then I'm gonna move on to your cheeks. So just the same thing, against resistance. Okay. So it's good, equal response, equal strength. There's no crepitus, no weird sounds. So I have her trachea here, I have her suprasternal notch, her angle Louis, and coastal angle. They all look good. So the next part, we are gonna have to partially remove your gown a little bit, just because I'm gonna have to listen to your heart and lung sounds. So is that okay with you? Okay, good. So I'm gonna go ahead, put this. So now I'm gonna be just checking, oscillating all of her lobes, the tracheal, the bronchial, bronchivesicular, and vesicular sounds. So good, those are all clear. I'm gonna move on to her heart. So I have the aortic, the pulmonic, the herbs, tricuspid, the mitral, and then so they all look good. They're all loud, the pitch is good, pattern, and they all sound good. There's no gaps or no murmurs either. And so the aortic area, we're listening in at the right second intercostal space. The pulmonic area, we're listening to in the second intercostal space. Herbs point, we're looking at the left third intercostal space. The tricuspid, we're looking at the left fifth intercostal space, and then the mitral area, we're looking left midclavicular at the fifth intercostal space. Okay, and so now I'm gonna go ahead and do her apical pulse. So I'm gonna go ahead and listen. We should be listening for 1 full minute. And I'm just gonna do 30 seconds for the sake of the video. Okay. So when looking at her chest, everything looks good. Her skin, no hair, no unusual lumps, masses, tenderness. So it all looks good. So now, Barbara, I'm gonna ask you to sit up for me. And now I'm gonna be checking your respiration. So Okay, those look good too. I'm gonna go ahead and take a look at your back, if you don't mind. And I'm just gonna feel, can you go ahead and take a deep breath for me? Okay, and I just wanna have you take one big breath. Okay, and I'm looking there for equal rise and fall of lungs, which they look good. And so now I'm gonna listen to her lung sounds. So Barbara, if you can just repeat E for me, and I'm gonna be listening here. Okay. Can you whisper 1, 2, 3? And I'm also gonna be listening. And then can you repeat 99? Okay. Good. So just one more time, I'm gonna go ahead and feel. Can you repeat 99 for me? Okay, that looks good. Her back looks good. It's all symmetric. It's proportional to the rest of her body. And so now, Barbara, you're gonna be laying on your back. So I'm gonna assess her bicep, her tricep, and her brachioradialis reflexes. So good. And we're gonna check all of her pulses, her brachial, radial, and ulnar. So typically, you know, we would go in the elbow, and then at her wrist, and those look good. They're all 2+ and regular. So Barbara, can you move your shoulders and your arms in circles so I can do your range of motion? So the patient would push your arms into circles. Can you go up and down? Okay, those look good. As I am feeling her, she has no heat, no redness. I don't see any crepitus, and it all looks normal. So now we're moving on to her arms. So her arms, the texture is good, hair distribution is normal. There's no scars, no lesions, no abrasion. So I'm gonna check your skin, Turger. I'm just gonna pinch your skin a little bit. Okay. And I'm gonna just inspect the palms and your nail beds. So your nail beds look good, they're consistent. And I'm gonna do capillary refill on each of your fingers. So I'm just gonna squeeze. Okay, and those look good. Those look good. And then let me do the other hand. Okay, good. So like I said, all of the size, color, temperature, that all looks correct. So now I'm gonna do her abdomen. So we have the 4 quadrants here. Again, I don't see anything abnormal. I don't see anything strange. Good symmetry, and everything looks fine. But I'm gonna go ahead and take a listen. So I'm gonna start in the lower left quadrant, or sorry, the lower right quadrant. And then, so I'm gonna move clockwise. Okay, good. So as I'm palpating, I'm making sure that it all feels good, all feels normal. And so Barbara, as I'm touching your stomach, do you have any pain? Okay. All right. So Barbara, can you tell me when your last bowel movement was? This morning? Okay. Good. Was it all the right consistently, the right color, the right amount? Okay. And how about when you urinate? Do you have any problems? Does it take you a long time? Is it burning? Do you notice any blood? No? Okay, good. So now I'm gonna go ahead, I'm gonna wash my hands, I'm gonna put on gloves. Barbara, I'm gonna have to check your private area a little bit, so I'm sorry if this is uncomfortable. So I'm gonna do the femoral pulse. So I'm gonna check that. Okay, that's all 2+ regular. I'm gonna palpate the bladder, make sure that there's no tenderness. And then again, I'm looking at the inguinal area, making sure that it all looks normal. And then the nodes, I'm gonna look at the upper and the lower nodes, and those both look good as well. So I'm gonna remove my gloves, I'm gonna wash my hands, and like I said, no lesions, no drainage, so we're doing good. So Barbara, I'm gonna ask you to turn on your side. I'm gonna make sure to get help if I need it, but for this patient, we're not gonna need any help. So again, I'm looking at the back, I'm looking at the sacrum, it all looks good. I'm looking at her anus, looks good, no hemorrhoids. And then I see no edema in her foot, in her ankle, or her sacrum. So those are all good. And so the patient can lay back flat. Okay, so now we are moving on to your legs. So for your legs, I'm gonna be looking at the texture. I'm gonna be looking at the sizes, make sure that they're all appropriate. Again, I'm gonna check the skin turgor, so I'm just gonna pinch the skin a little bit. Good. As I'm feeling, there's no temperatures, there's no scars, there's no abnormal abrasions, hair distribution is good, and those are all good. So now I'm gonna look at the feet and the heels. I'm gonna check again for capillary refill. Okay, those look good. And on the other foot. And I don't see any clubbing on either of her feet, so those are all good. So I'm gonna do one thing. I'm gonna touch your toe, and I just want you to close your eyes and try and tell me which toe and on what foot I'm touching. Okay. Okay. So the left big toe, that's correct. And then close your eyes. Okay, those are good. So I'm gonna check her reflexes. So Barbara, if you can just push back against resistance in my hands. Okay, that looks good. So I'm gonna check her pulse, her popliteal and her dorsalis pedis pulse on her ankle. Okay, and then Barbara, can you bend your knee for me? Good. Can you flex and extend your ankle and your foot? Okay, good. And I didn't see any edema or any tenderness at all in the feet or the ankles. All right, so now we are going to move on to another part of your assessment. So I'm gonna make sure that the bed is locked. I'm gonna put socks on her to make sure, the non-slip socks on her, and I'm gonna make sure that the bed is to the lowest position before I do this. So Barbara, I'm gonna have you sit up. Okay, I'm gonna check your pulse. Okay, are you dizzy? Are you feeling any weakness? No? Okay, so Barbara, I'm gonna just help you to stand. Okay, do you feel any dizziness? No? Okay, and let me check her pulse again. Okay, so now I'm gonna have Barbara, I'm gonna have you take 5 steps away from the bed and then 5 steps back to the bed. So 1, 2, 3, 4, 5. Okay, and now you can come back. 1, 2, 3, 4, 5. Okay, so her coordination looks good. Her movement looks good. Good balance, good gaits, posture is correct. So good. All looks well. Now I'm gonna have you turn around. I'm just gonna feel your spine. If you can just bend over a little bit for me just to see. Okay, and it's all aligned, it all looks straight. No curvature to the spine. So now I'm gonna move on to the joints. So I'm gonna check her joints for heat. I'm gonna make sure that there is no swelling, no masses, and everything's good. And so Barbara, you can sit down and you can lay down. Okay. And so at this time, if I had a urine sample, I would inspect the color. I would inspect the amount, the clarity, and if there's any odor. Okay, Barbara, thank you for letting me do the assessment on you. Do you have any questions about anything? Okay, I'm gonna make sure that the bed is all the way down. Make sure that only 2 handrails are up. I'm gonna give her the call light back. I'm gonna open the curtains and I'm gonna wash my hands. And so again, Barbara, I'm gonna be here all day with you. So if you have any questions or concerns, make sure that you let me know. Thank you.